My name is Steve Caputo. Worked at JP Morgan for a little bit, just recently retired about 8 months ago. The procedure I had done was a right shoulder replacement with Dr. Thacker. I hurt my shoulder many years ago from a sporting accident, and I had gotten it orthoscopic surgery many years ago, but over the years it got progressively worse. And worse is where I couldn't move it. So if I went to weight lift, there was pain. And what really made me do it was when I slept at night, if my arm would go behind my back, I couldn't move it. It would get stuck. I'd have to use my other arm to pick it up and bring it back over. So once the pain got too much, and then actually the cortisone shots weren't helping at all. I was waking up 5 times, 6 times a night, and I just came in and saw Dr. Thacker and said, we need to do something. I didn't do a lot with my arm. I used to swim. If I tried to swim, I couldn't bring my arm over, for an overhead stroke. Weightlifting, I had to cut back on certain things. I get severe pain, pain where I drop the weight. Just normal things that you want to do. If I rode a bicycle, and I ride a bicycle a lot, if I hit too many bumps when I'm riding, I'd feel pain all through my shoulder. So a lot of my activities were all driven by how much pain can I take rather than endurance. So it was more geared around pain. My experience with the surgery and the hospital and everything that led up to that, I was pretty comfortable because again, I know Dr. Thacker, he's treated me for other things, he's seen my shoulder, so I was pretty comfortable going in. It was very easy, going through the hospital procedure and getting set up and going through everything and getting prepped was all very good. Dr. Thacker came in and he saw me right before, and he said, is everything okay? Are you comfortable with everything? This is what I'm going to do. And we had a conversation. So it was all it was just cool. It really wasn't a bad experience, not by any means. It was a great experience as far as surgeries go. So he explained, he said, you know what I'm going to do, this is what I'm going to do, this is what's going to happen after. And then, they put you out and you go through the surgery, and I woke up and it was exactly what, we thought it was going to be. No pain, it was surgical pain, right? But it wasn't that debilitating pain that it was anymore. So the experience itself, all the way from the hospital to the surgery to post-surgery, was all very good. Sure, the post-op and physical therapy, it all went really well. I go down to the Monroe office, everyone there was very, they know you on a first name basis, everyone's like, hi, how you doing? You go in, you meet everyone. They do a consultation in the very beginning to try and see where you are. They take the brace off and they move you around a little bit, in the first, I guess, few days, weeks, it's really them moving your arm because they don't want you to move it. Everything still has to mend, for like 2 weeks. So, but the PT was very good. They were attentive. They made sure, if they're moving, are you comfortable with this movement? Tell us, if you're not. And they stretch a little bit, which is what they should do. But it was all very good. January 4th of last year, I had the surgery. So I'm just a little over a year out of surgery. And I feel great. There are things that I can do now that I couldn't do before. So I can swim again, and I swim a couple of nights, a week. I used to play a lot of racket sports when I was younger, and I stopped because I couldn't play anymore. So I'm playing pickleball now about 4 days a week, 2 hours a day. I could never, ever get that whole range. I couldn't do this at all with my other shoulder, my real shoulder. So it's opened up a whole new world that I wanted to do, was a little afraid to do because surgery is surgery, but I trusted Dr. Thacker. And it's opened up a whole new world of sports again that I never had available because of the initial shoulder pain. So if I had to say anything to anyone thinking about the surgery and what leads up to it and what they might think about and if they're afraid or if they're not sure, do research, talk to Dr. Thacker. He'll explain everything to you very candidly and say what it's about, what he's going to do, how it's going to happen, what you'll feel, after surgery, and how you have to stick with PT, because that's key. But no, I would say to people, take the plunge and do it, because from my personal experience, I wouldn't have things available to me now that I would normally have done, because I can ride a bike again without any pain. As I said, I play pickleball 4 times a week. I'm back in the pool and swimming laps, and not just a couple of laps. I'm up to about 15 Olympic laps, which might not seem like a lot, but that's not bad from someone who wasn't able to do it. So I would say definitely take the plunge. I don't think anyone would be sorry. Again, that's my case, it's all individual, but I'm not sorry at all. I'm very glad that I did it, and I'm glad that I did it when I was a little bit younger, because I still have all my mobility to still do the things that I'd like to do.